right? Hi, my name is Sophia. I'm the viewer nurse today. Can I have your full name and date of birth?
Stated.
If you don't mind, can I verify that on your wristband?
Yes.
Okay. Thank you. Are you in any pain today?
No.
Do you have any allergies to latex or shellfish?
No.
Okay. Do you, well, I'm here today to do a head to toe assessment on you. I'm just gonna look at you from head to toe. Do you have to go to the restroom?
No.
Okay. If the patient did have to go to the restroom, I would examine their gait, posture, any abnormalities that are not normal. So, okay, I've already took my vital signs, my blood pressure, my respirations, my pulse, and my temperature. Everything is within the normal limits. I'm also at this time observing the patient's overall stature in the bed, the facial expressions, any cyanosis, diaphoresis, pallor, any labored breathing or anything like that, muscle twitching that I can see. Okay, so at this time I will put on my gloves and I will raise the bed, the head of the bed up. Okay. Okay, so this, hi, I'm sorry, dear. So at this time, I'm going to examine the patient's scalp and hair. I'm looking for and feeling for any tenderness or bumps or looking for any bruises or lacerations. I'm also looking for any pediculosis, dry scalp, alopecia, anything that I can see. No, I don't see anything. And also I'm looking at the face to see if the features are symmetrical, if there's any scars or tattoos on the face, anything that I can see noticeable. Okay, so now I'm going to look at the eyelids. I'm checking the eyes and looking at the conjunctiva and the sclera and to see if there's any drainage noted or any redness or irritation. Do you have any problems with headaches or seizures? No, you don't? Okay, that's good. So now I'm going to conduct a test on you called PERLA, and it means pupils are equal reactive round to light and accommodation. Pin light. So I'm gonna put my hand here. You can just look straight ahead. Okay, thank you. Okay, thank you. And so now I'm gonna check your extraocular movements. I'm just gonna ask that you follow this for me. Good. Okay, and also if you can just keep your eye on the pen light here and watch it. That's checking your accommodation. Okay, and now I'm gonna do your peripheral. Just let me know when you can see this. You can see it? Okay, good. You can see it? Okay, good. Next, I'm going to move on to the nares. And do you have a history of any bloody noses, deviated septum, any nasal polyps? Nope. Okay, so now I'm just looking in the nasal mucosa. It's nice and pink and moist in there. Okay, I'm gonna do the patency test. I'm gonna ask that you blow. Okay, all right, that's good. And so now I'm going to also palpate the maxillary sinuses and the frontal sinus. You don't have any tenderness here. I don't feel any swelling. Okay, that's good. So now I'm going to look in your mouth. Do you wear dentures? Sometimes? Okay. Do they fit well? Okay, that's good. So I'm gonna look in here to see. Can you say ah for me? Ah, okay. I can see your uvula and your tonsils good. Can you stick out your tongue and move it left to right? Okay, that's good. So next is your ears. Look at your ears. I'm gonna look on the outside to see if I see anything, any dry skin or anything coming out of there that's not supposed to. I'm gonna pull up and back for an adult, and I'm gonna just look in the try to see the tympanic membrane to see if I see any cerumen. Nope, I don't see any. Come to the other side. I'm gonna look up and back again. Okay, that's good. I'm gonna come stand on this side of you, sir, because I like this side better. Next, I'm gonna ask you, I'm gonna palpate your lymph nodes here. Do you have any problems with your neck? Have you ever had an enlarged thyroid? Problem swallowing? Okay, that's good. Okay, I'm gonna check your carotid artery here. Okay, it's bounding, it's strong. Okay, and I'm just also gonna feel for your trachea and make sure it's midline, and also I'm feeling for your thyroid. Okay, everything feels good there. Can you bend your neck down for me to your chin? Can you bring your chin to your chest? Thank you. Can you move your head from side to side? Okay, thank you very much. And also at this time, I'm observing the patient's skin at all times. He doesn't have any tattoos on the neck or any bruises or anything like that. Next, I'm also going to listen to the lungs. First, I'm going to inspect the chest to see if the patient has any labored breathing, burrow chesting, or abnormal rise and fall. The patient doesn't, okay? If you don't mind, I'm going to put this down just a little bit here. Okay. I'm going to listen to 4 spots on the front of the chest. Take a deep breath, take a deep breath, take a deep breath, take a deep breath. Okay, and also while I'm here, take this out my ears for real. I'm listening to 3 spaces on the right, and we would normally go underneath the clothes, but for this purposes, we'll do on the outside. Okay, take a deep breath, 3 places. Okay, take a deep breath, take a deep breath. Okay. Oh, while I have my stethoscope in, I would go ahead and listen to the heart. So I would listen to the aortic area, which is to the right of the sternum, second intercostal space. I would listen to the pulmonic area, which is the second intercostal space to the left of the sternum. Herb's point, which is the third intercostal space to the left of the sternum. The tricuspid is the 5th, I believe, intercostal space, and then the mitral is the 5th intercostal space, but it's in the mid-clavicular line. Okay, your apical pulse sounds great. It's strong. I can hear the lub-dub clear. Okay. Now I'm going to percuss your chest. Just breathe normally. Okay. Thank you. You having any pain? No. Okay. Also, I'm palpating at this time. Can you say 99?
99.
Okay, 99 again.
99.
Okay, thank you. You don't have any tenderness and swelling. Okay, that's good. So at this time, I'm gonna raise you all the way up. I'm gonna ask that you can sit up for me. I'm gonna listen to 6 places on the back of your back. Listen to the back of your lungs. Okay. Hold on, let me get myself right here. Okay. You just had me. Okay. So, I'm listening to 6 places on the back here. Take a deep breath. Take a deep breath. Take a deep breath. Take a deep breath. Do you have any pain? Okay. Take a deep breath. Take a deep breath. Okay, that's great. So, next. Okay. So, I'm going to, ooh. You look heavy there. I'm going to percuss just as well I would do in the front. I would do it in the back, and I would also palpate and inspect and do the chest excursion. I would, put my hands together on the patient's back, have them take a deep breath. If I see our movement of my hands equally, then that's normal. If I see anything different, then something's wrong. Okay. Thank you, dear. I'm sorry. You doing okay? Okay. Thank you. Okay, so now I'm gonna lay you back down. I'm going to, I guess I'll go ahead and do your abdomen. Okay, I'm gonna, how's your diet? Do you eat well? How's your bowel pattern? Ooh, this bed too low.
It's good.
Do you have any constipation or diarrhea that we need to know about?
No.
Okay, that's good. Okay, I like them high up. Okay, so I'm just gonna show your abdomen a little bit. And also at this time, I'm inspecting the abdomen to see if it's distended or concave, and it's not, it's normal. So I'm gonna also take each quadrant for 1 minute. Start with the right lower quadrant. If I didn't hear any vowel sounds, I would listen for 5 minutes. So I hear something. Okay. Okay. Also at this time I will listen for the bruits. I will start with the aortic one, and that's right underneath the sternum epigastric. So I'm listening there. I turn my stethoscope to the bell. I'm listening to my renals on this side and this side. The iliacs over there, right here, and then the femorals down here. Okay, good. Do you have any pain? No. Okay, that's great. Okay, I'm also going to percuss in each quadrant here. And then I'm going to palpate 2 centimeters. Okay, do you have any pain?
No.
Okay, I don't feel anything abnormal in here, any nodules or anything. Okay. So that's that. Okay. So I need to do your arms now. So first thing I'll do is I will check your pulses here. I'll check the brachial, the inside here, simultaneously and at the same time. And then radials, I will check them as well, one at a time, together. Okay, they're strong and bounding. I would also check your reflexes. Which one is on top? The triceps back here. Okay, I see movement here. And I would check your biceps up here. Okay, then I would check your brachioradialis, which is here. And I would do that on both arms. Okay, come over there. Do it. Also, I would administer the Allen test, and that's just to see for circulation. Also, I'll do the capillary refill here as well. Okay, it's less than 3 seconds. Okay, less than 3 seconds. And so for the Allen's test, I will hold the radial and the ulnar artery at the same time, ask the client to make a fist. And as they release, I would release one at a time and to document the time it takes for the patient's hand to turn back to color. I would do that on both hands. Also, I would, all the time, look at the patient's skin to see if there's anything unusual, bruising, tattoos, scars, any tender spots. We're also going to do range of motion. Can you lift up your arms for me like this? Can you bring them out to the side? Can you bring them down? Okay, that's great. Can you squeeze my hands? Thank you. Can you push against my hands? Can you pull against my hands? Okay, thanks. Now we are going to move on to the lower extremities. Thank you so much. Are you experiencing any pain at this time?
No.
No? Okay, that's good. Just gonna show you off a little bit here. Whoops. Okay. The first thing I would do is I would check your femoral pulses. Okay. Femoral pulses together and by themselves. Check for your popliteal here. The posterior tibialis, which is on the inside, and then the dorsalis pedis at the top. All of those are equal, strong, and bounding. I would also go ahead and check your reflexes at this time. The patella, the Babinski, and the Achilles. I would check that on both legs. Also, I'm looking for the saphenous vein to see if the patient has any tenderness or if there's any enlargements to both the back of both legs. Okay, everything looks good. Also, I see you have a wound here that's already been changed today. So, what happened? Could you tell me how you got this? Okay, are you having any pain with it?
No.
Okay, I see no drainage with the dressing. So we would measure it and we'll do what we have to do, but since it's already been changed, we're just gonna leave that there. Okay, we're gonna do range of motion. Can you bend your legs up, spread them out, move them all around? Okay, that's good. Do it the same to this leg. Okay, you have any pain? No? Okay, that's good. Can you pull against my hands? Can you push against my hands? That's great. Also, I'm gonna check capillary refill down here. Okay, it's less than 3 seconds. Okay, think I'm good on the lower extremities. Next, also, what I forgot to tell you is that we also conduct the Weber test and the Ryan test, and that's for hearing. It's just normally they use a tuning fork and we would place it on top of your head and on your mastoid process. It checks you for air and bone conduction and hearing loss. So that's one thing we didn't do. Also, for the female, we would have her raise her arms up for us to look at the breast. Raise her arms up, put them on her hips, and bend forward. And we would start palpating from the nipple out, all around in the 4 sections. And we're just feeling for any nodules, or if the patient has any tenderness, if there's anything that we can see visible. Also, when the patient bends down, we're looking for inverted nipple or anything that will look abnormal, which may be signs of cancer. Okay. Is that all? I think we're gonna roll you over, if you don't mind. And I will also, since I have you uncovered, I'm going to talk about the genitalia. If we have a male patient, we would lift up the penis, the shaft, and inspect the outerness to see if there's any drainage, any lesions, any critters crawling around there. Ask them about their sex life, erectile dysfunction, any problems with going to the bathroom, urinating. Pull the skin back, clean around the foreskin, and lift the scrotum as well. You know, check for symmetrical size, and if they have any pain, tell them to stand up and cough. You could do that too. And for the women, we would open the labia minora and majora and just inspect, do the same thing. We're looking for any drainage, any lesions, any irritation, redness, itchiness, looking at the hair, how it's located, all that. Okay. Whew, that was a lot. Okay, so now, Bob, we're gonna roll you to the side. Okay. Oh. Oh, Bob now. Okay. All right. So I have the patient to the side, and I'm examining also the back again, the back side from head to toe, the back of the neck, just in case I didn't see it. Anything that maybe I missed earlier, I would just look at this time, just to see if any bruises, contusions, lesions, etc. Also at this time, Bob, I'm going to look at your anus. Do you have problems with hemorrhoids, bleeding of the rectum? No? Okay, that's good. I would change my gloves, put on lubrication, ask the patient to take a deep breath. As the sphincter relaxes, I would stick my finger in and just palpate the rectum to see if there's any maybe polyps right there or any lesions or something that I could be able to feel. So you don't have any of that. Okay, so we're done, Bob. Thank you so much. If you have any concerns or if you have any pain, let me know. It's almost dinner time. I hope you like spaghetti because that's on the menu. So I would make sure the patient is comfortable in bed. Car light within reach, bed in those positions, 2 side rails up. Yeah, so let me go ahead and lower the bed. Oh, wrong rectum. Okay, that's good enough. I'll wash my hands. It's coming out the patient's room, and that's it. And I'll also make sure the call light is within reach. Bed in those positions, just in case I didn't say it before. 2 side rails up. Patient is comfortable. No needs at this time. Thank you.